Okay. Good evening, everybody. Good evening, everybody. Good evening, everybody. Welcome to the November 14th, 2022 meeting of CB11's Human Services Committee. My name is Isaac Scott. I am the chair of the committee. This meeting is called to order at 6:03 p.m. Tonight, we are joined by Community Associate Marlene Pierre, the staff liaison to our committee. To conduct an efficient meeting, I'm going to just go through a few ground rules real quick. No one may speak until granted the floor. CB11 members, if you have a question, please mute yourself. CB11 members, if you have a question about board business or wish to make a motion, please raise your hand through the Zoom. If you click the participants icon, the participants panel should appear and you should find the raise hand function there. If you still have technical difficulty, you may click on the chat icon and relay your difficulty to the staff, and we try to get everything situated for you. The chat function should not be used for CB11 business or questions about agenda topics. All such remarks should be made on the record by raising your hand through Zoom. Chat should only be used to alert us of any technical difficulties you are having or to state in writing information like an email address that was already stated out loud on the record during the meeting. When a member is given the floor to speak, I will identify you and you can unmute yourself so that you can speak. Please keep your questions and comments succinct and germane to the discussion. I just want to say that just real slow. So we just remember that we have a long meeting tonight, and I just want to ensure that we can make it through and we are able to get everyone's concerns and questions addressed. Members of the public, if you have a question or a comment about subjects on the agenda, please raise your hand through the Zoom and wait to be recognized. We will now take attendance by roll call. Board members, you can unmute yourselves and answer present when your name is called.
April Autry.
Present.
Juhab Chowdhury. Osendi Garcia. Brandon Gillespie.
Present.
Jennifer Meyer.
Present.
Arturo Perez.
Present.
Isaac Scott.
I am present.
Robin Strachan.
Present.
And Anne Marie Vasquez is excused. You have a quorum, Pastor Scott.
Thank you very, very much. Okay. The agenda for tonight's meeting was distributed ahead of time by the board office and was posted online. If there's no objection, we will adopt the agenda as stated. Committee members, if you object to adopting the agenda, you may raise your hand through the Zoom. Okay, don't see any raised hands. The committee minutes from our last meeting were, correct me if I'm wrong here, Marlene, a template was made visible, it's present on our site now, and our actual minutes will be posted tomorrow. Am I correct in that? Okay.
Yes.
Okay, great. Yes, so I'll keep going from there. If you object to any of those minutes or what you've seen so far, I guess you can raise your hand. Okay. All right, seeing no objections, we can move this forward. As I stated, the minutes will be up on the website tomorrow. Cool. So we have a number of announcements. I'm going to walk through these. I was able to get as much information as is possible to just make sure that it's not a incomplete update, but also don't want to give all of the information. So I'm going to share exactly what I say with the links to all the information in the chat right after I give each announcement. And I believe it is for the first announcement, you may need to email me for the document that has the link to actually attend the hearing and the phone number. So there's like more pertinent information that you'll need. But with that first announcement, Notice of public hearing and opportunity to comment on proposed amendment to provisions of Article 207 of the New York City Health Code. This Article 207, just if you're not already familiar with it, is the article that governs general vital statistics provisions. So this oversees everything from correction of vital records to preparation or filing of certificates or reports, inspection of vital records or data and transcripts, and et cetera, et cetera. The actual, I was able to look a little deeper into the announcement. The New York City Department of Health and Mental Hygiene are proposing that the Board of Health amend Article 207 of the New York City Health Code to allow an application for correction of a birth certificate to be made on behalf of a minor by the government agency responsible for the custody and care of the minor. This hearing is being held at, it's a public hearing on the proposed rule, so you'll be able to weigh in, give feedback. The public hearing will take place at 10 a.m. to 12 p.m. on Tuesday, December 6th. The hearing will be conducted by video conference, and you will also be able to access it via internet and telephone. And if you want that information specifically, if you are interested in attending that hearing, I'm going to paste all of this information right now into the chat for you. Oh, thank you, April. I appreciate you. Second. One second, yeah. Let's see. All right, so let me just do this. It's not letting me copy my, okay, maybe I had too much text in what I was trying to copy to y'all. So what I'm going to say is for more information about the hearing, and I believe the document is also just been posted in the chat by April as well. You can just email and I'll send you the full document to it. Yeah, so let me move on. So the second announcement is the NYC sexual health clinics are coming back online with expanded services, included rapid testing for sexually transmitted infections and HIV PrEP continuity of care, excuse me. The NYC sexual health clinics provide low to no cost services for sexually transmitted infections, including HIV. Anyone who is 12 or older can receive services regardless of immigration status. That's very important. No parental consent is necessary. That's also important. If you do not have health insurance or cannot pay the sliding scale fee, you can still get services, even more important. So I'm gonna try to paste this whole little thing in the chat right now. I think it was the size limit that was giving me trouble on my last year. Yes. Okay. So that was announcement 2. So next announcement, very, very pertinent to a lot of what we're seeing on the news and just shared concerns, what I think many New Yorkers. Governor Hochul and Mayor Adams announced major actions to keep subways safe and address transit crime, building on ongoing state and city collaboration. They have a very extensive overview of what steps they are taking to ensure more safety. I'm going to read what I believe is most pertinent to this committee, but I'm going to also share the links, more than one link. I found a subway safety plan and the larger link to what was emailed to the committee about this. So to continue to address the unhoused population sheltering in the subway system and those who are suffering from severe mental illness, as well as build on progress since Governor Hochul's deployed safe options support crisis intervention teams, Governor Hochul has directed the New York State Office of Mental Health to create 2 new dedicated 25-bed units for a total of 50 inpatient beds. In addition, OMH will, which is the Office of Mental Health, will expand crisis intervention training for MTA police, the NYPD, and EMS, EMT, teaching them best practices for engaging individuals experiencing homelessness and ensuring they are fully informed of the statutory authority for transport of individuals in need of psychiatric evaluation. These expanded initiatives build on ongoing collaboration between the state and the city on subway safety and outreach to the population experiencing homelessness. Governor Hochul and Mayor Adams also pledged to explore strengthening and improving laws, providing assistance to those suffering from serious mental health illnesses. So I'm going to post the links for folks to just read up about more of what they're saying in this. This was a very short, this was like literally like a paragraph or 2 out of that. I just wanted to address specifically some of the initiatives to engage folks with mental health issues, because that's what we're seeing is the majority of folks who are on the subways and, causing trouble, if you want to call it that. So that's the information on that. Okay. I do encourage I'm not going to just breeze by that. I do encourage everyone, these updates are very, very important. These announcements, are very important, but I specifically encourage everyone to really look deeper into the mayor's plan and the governor's plan to ensure safety on the subway and really interrogate at what expense it comes at, because that's very, very important. We have to ensure that, we're operating with the even balance of humanity, ensuring that folks get the support and help they need and folks are able to travel safely. So please do take the time to, when you traveling to work, while you on the subway or something, please, I just threw the links in the chat. Please, just look through it, skim through it, and if you fill out surveys or you're in meetings or in different spaces, comment on these things, weigh in on them, stuff like that. This is important. This is how we're able to, use our voices on a daily basis. So yes, please. And finally, 4th announcement, Mayor Adams issued an emergency executive order 242, which extends the emergency order in place for 30 days through November 21st, 2022. So that means we will be continuing to meet virtually until November 21st, unless we hear otherwise. So far, as you all have been seeing, it's been getting extended month by month. So we kind of always in limbo on what's it going to be, but we'll keep you updated. So all meetings prior to, I want to say up until and on that day will be virtual. And after that, we will, if we don't hear back anything, we will be meeting again in person, if I'm not mistaken. So yes, that concludes the announcements. Any questions on how you can get this information from me? Although I did just put it in the chat, but if you rather me email it to you, or if you, I don't know. I just want to open the floor for any questions real quick, but I want to keep it moving if everyone's cool. Let's see. All right, we cool. Appreciate y'all. Okay, so for our first informational update, I'm not looking at the participant list right now, but is Cole Riley on?
Yep, I'm here.
Okay, great. I'm going to let you go ahead. Because we have such a tight agenda, I am going to ask that you please keep your presentation to 5 minutes and allow 2 minutes for just any questions that folks might have.
Yeah, sure. I'll keep it short and sweet.
Thank you.
So
very
I
much.
just wanted to provide an impact update since we've been in the district in April. So as a refresher, my name's Cole. I run Welfare. We're a new nonprofit organization based here in New York. We launched in Brooklyn last year. We came into the district this April. What we do is deliver premium, better for you, nutritious packaged groceries for free to families living in New York City public housing. And we do this every month with our Better Box program. We activated 2 NYCHA developments here in East Harlem, Taft houses and Johnson houses. And since April, we've been delivering delicious packaged goods like grab-and-go snacks, drinks, pantry goods, supplements, products that you'd see in Whole Foods. These premium packaged goods we're delivering to families for free. And we've had an incredible impact since April. So a few numbers, a few stats. Across those 2 developments, we've got 410 households signed up for our service, which is roughly 1,200 people. Since we launched in the district, we've delivered 2,500 boxes in total, which is a little bit over $500,000 worth of product. And when we look at 2023, we want to definitely expand beyond just those 2 developments. We want to naturally go to King and Jefferson. We've had a lot of interest a little south, down in the 90s, a few developments there. But we definitely look to have a long-term impact and grow this program and grow what we eventually want to become. In this district, we want to have a long-term impact here. So I'm always looking for more partnerships, more opportunities to partner up with existing organizations in the district. What I'm going to do is drop in my contact information, and you can go to our website. You can learn a little bit more about what we're doing, the brands that we're partnered with for this free product, why we're a unique service compared to these long-standing legacy nonprofits, these food pantries, what we're doing differently, and why we think we're going to be able to build a really sustainable and transformative organization in the long term. So I'll drop that contact information in there. Anybody that's looking to learn more, partner, whatever it may be, you can reach out to me directly. But I appreciate all the help from everybody in the district so far, folks from across different committees and across CB11. And thanks so much for letting us kind of come into the district, get off the ground, and we look forward to a really great 2023.
Thank you very, very much for your work in East Harlem. We appreciate it. Are there any questions, comments? Yes, Robin, please. Hi, Robin.
Good evening. I was just curious, other than being a NYCHA resident, what is your criteria?
That's the criteria. So we're focused simply on NYCHA public housing, and we go development by development. So where we launched in Brooklyn, we launched with 4 developments there, and then in East Harlem with 2, with Taft and Johnson. It's the simplest means test for us to determine food insecurity, folks on SNAP, folks on WIC. And we know it certainly leaves out whole pockets of folks that need these types of services, but this is a sustainable way for us to start. We want to expand not just to more developments in 2023, but beyond that NYCHA confines. I want to be able to sign up folks that are on SNAP but aren't in public housing, those that are in WIC, living in multifamily households, shelters. What we're doing with the products that we deliver, these better for you packaged goods, we can be very flexible. We're not dealing with perishables. So this was just our start, easiest way to get off the ground, but we definitely are cognizant that this is just a limited customer base for this service.
Thank you, Riley. So we have one more. I see we have a hand raised in the attendee section. Marlene, I'll let you. I won't mess with anything.
They can speak.
Okay.
Hi. Thank you so much. I appreciate it. My name is Maria Elena. I was just interested in finding out if you were going to expand the program call because I work with recent immigrants who are not documented, and probably, they can access those amazing resources that you're sharing. And the other thing was a technical question. I'm not able to see the stuff that's posted in the chat. I don't know if because I'm accessing it through my phone. So I was wondering if there was any other way to get the information that you guys are sharing in tonight's meeting.
Yes, I can email it to you, but I'm sorry. Oh, 1 second. I can email the information to you, but also could we figure out, Marlene, how we can ensure that folks can see
Yeah,
the
it's a
chat?
technical issue happening on the back end I'm trying to fix.
Thank you.
So just give me a second, okay?
Yep, thank you. Go ahead, Mr. Riley. Sorry about that.
Yeah, no, and to answer that question, like I said previously, we want to expand beyond just public housing because undocumented immigrants is the perfect example. Folks that are typically on a food assistance program but don't qualify for public housing. So we want to be able to reach those communities. It's going to be interesting trying to figure out how we do that. I think that's in partnership with public markets like La Marqueta or churches where we can find these distribution points. But certainly that's top of mind in 2023. Really, this year was just getting off the ground, establishing a bit of a presence in the district. And then 23, we can really kind of stretch wide and start touching more than just folks in public housing. So really, I think staying tuned, signing up for our newsletter on our website, which I'll drop in the chat, following along and seeing as we expand, you'll see that eventually we'll be able to reach that base.
Thank you. And I see we have one more question. Yes. Sorry.
Hi, so my question is, you mentioned Johnson and Taft. Is
Mhm.
there a plan to expand to the other public housing buildings in East Harlem?
Yes. So I would say timeline wise, Q1, naturally King and Jefferson. And then Q2, Q3, we start to go a little bit more south and a little north, but south down to Washington Houses and around Metropolitan Hospital. But I'd say next up on the list, because they're right there on that strip around East 114th, East 115th, would be King and Jefferson.
Thank you for that question, Selena. Okay.
Sorry.
Yes.
So to the individual that spoke about the chat, it's fixed now. So if you're still not seeing it, it might be on your device's end.
Marlene, will they be able to see what was already posted in the chat?
Yes.
Okay, great. Okay.
Cool. Also,
Cole.
thank you so much for the audience.
Thank you very, very much for being here. We appreciate the update. Okay, let's keep this going. Yes, I don't see Pauline here. Is someone here not listed as part of DOHMH who's giving updates today?
Yeah, I'm not seeing Pauline either, so maybe she wasn't able to attend today.
Okay, cool. So we'll just we'll hold off in hopes that she will show. Maybe she's running a little late. Yes. So we'll have our next set of updates from East Harlem Co-Ed. Selena, I think are you? How are you? And
I'm well, thank you. Thank you, Pastor Isaac. Hi, everybody. I'm Selena from the East Harlem Co-Ed, and November is Injury Awareness Month, National Injury Awareness Month, and we're going to be having a free workshop / training on November 17th. And that's going to be in the East Harlem Neighborhood Health and Action Center. That's at 4 p.m. There is a registration form. It's free, but there's a registration form. And what you're going to learn there for those who come is a hands-on training on how to stop the bleed. And that's literal, how to stop if you're in an emergency and someone's bleeding before the EMS comes or emergency, how to apply a tourniquet, how to apply pressure. So this is a hands-on training. It's free of charge, and it's from 4 to 5:30. There will be refreshments served. But the training in and of itself is very substantive. So I welcome and invite all to come, pass it on. I will put the link to the registration in the chat. And that's Thursday, November 17th. Next month, we're going to be having, and that's December 15th, we'll be having our holiday meeting, and we welcome all. to attend to that. And it's going to be not only celebration, but also a time to reflect as a community about the past 2.5 years and talk about maybe some lessons learned and some ways we can sort of move forward, or things that we can do better. And we invite organizations who provide services in the community to talk about how we can all work together and set up plans. And then lastly, I'm going to put our email in the chat. We invite people to become members of the co-ed. So this month is a training. So it may not be the best time to become a member, but it's a great time to take advantage of a free training. But in December, we'll have about us and talk about sort of the advantages of joining this emergency preparedness group. So we welcome you all. I'm going to put my Gmail, which is eastharlemcoed@gmail.com on the chat, and also our website, which is eastharlemcoed.org, excuse me. And lastly, for anyone, so COVID is still a thing, and there's a rise in flu, and there's a rise in respiratory diseases, and the co-ed also provides PPE. So if there's ever a need for test kits or masks or hand sanitizer, please feel free to email the email that I will drop in the chat. And that's all I have. Thank you.
Thank you very, very much, Selena. Does anyone have any questions? Thank you so much for telling us about that training. If I can't make it myself, I'm definitely going to try to send somebody. That's important. That's important, really. Okay, seeing no hands, I'll keep this moving. Thank you again. So we will, a new addition to our update section, which would be every month, is an update from Borican Neighborhood Health Center. I think this month, Art, our vice chair, will give those updates. Art, whenever you're ready.
Sure, thanks. Just a few quick updates. In November, we're focusing on diabetes and diabetes awareness. And we're encouraging people to get their glucose tested and their HbA1c tested as well. And as always, we're continuing our outreach van events. We have a Borican band that goes throughout the entire East Harlem community. Last month we were at the Open Street event on October 30th. We were at La Marqueta on October 31. And for the last month, we reached over 500 people. And of course, we're going to continue to do that in November. Of course, Borican Neighborhood Health Center is a primary care center in East Harlem. We've been here for a very long time, since the 1960s. And we're continuing to follow our mission. Included with primary care, of course, is all the COVID activities. We distributed over 400 COVID kits just in the month of October. So there's a constant demand for COVID kits. Of course, we're providing COVID vaccine. And we're also encouraging patients to get their flu vaccine, again, during the month of November. We also have a food pantry. And in November, we are going to be distributing food, as we always do every single week, to our neediest patients, as well as Thanksgiving turkey that we're getting. We're getting some of those food products from the New York Common pantry. And that's pretty much it for now.
Okay. Thank you, Atara. I appreciate you very, very much. And does anyone have any questions for Art before we transition? Okay, great. This is great. Great. Thank you very much again, Art. This is great. Okay, so I'm going to move us on over into our presentations and our discussions. So first, we're going to have an informational discussion regarding our request for a letter of acknowledgement for Vita Family Services to transfer their existing license to operate programs through Prosema, Inc. And I see we do have, okay, yes, we do have both Christopher and Melanie on. If you are ready, you can unmute yourself and begin. I am going to ask you the same thing. If you could just like keep your presentation to maybe about 10 minutes and leave some time for folks to ask any questions. Christopher, Melanie.
Hi, good evening,
Hey.
everyone. My name is Giamara Rosado from Acacia Network. I'm the executive deputy counsel there. Melanie is actually traveling and cannot participate this evening, but
Okay.
I'm on the line and then
Okay.
to discuss Promesa Inc.
Thank you. Thank you very much. Do you mind changing the name on your window if you can?
On my window?
Yeah, because we have Melanie on your.
Hi, just put your name in the chat. I'm sorry, Isaac. Put your name in the chat and I'll change it on my
Yeah.
end, okay?
Okay. Thank you.
Thank you so much.
Hi, everyone. So I'm Angela Mamelka. I'm the Vice President for Behavioral Health Services. I can just give a quick overview of what the request is. So Vita Family Services is operating on 105th Street. Christopher is on the line, the current executive director. And what we're requesting the state, Oasis, is to allow us to transfer the certificate of operation under Promesa so we can continue delivering the service out of that same location. Christopher, did I miss anything? I see you now. No, that's good. It's an outpatient 822 program. So it's a substance use disorder treatment program that is already existing in the community. Like I said, we're working to transfer the certification so we can continue that service.
Thank you very much. Could you tell us a little bit more about the services, and then I'll open it up to any committee members for questions that they may have, and then we can just move forward with entertaining a motion.
Great. Christopher, do you want to explain what you're providing currently? You're muted. I'm sorry. There you go. Oh, we can't hear you. No, not yet. No, I know that we have limited time, so I'll just give an overview, and then if I miss anything, Chris, just add it to the chat if that's okay. So an Oasis 822 program is an outpatient substance use disorder treatment program, non-methadone, but we do provide access to other medication assisted treatment, would be referral based. But we provide individual and group counseling this program is 18 and older. We are looking at expanding to provide some more youth services if that was needed through the same license. But it's for men and women who are seeking recovery. And as I stated, it's non-methadone, so it would continue that way.
I know that you maybe you don't have the answer to this, but maybe you do. Could you say a little bit more about what youth services would look like if you were to expand to it?
Yep. So Oasis, they actually allow us on our 822, our outpatient programs, that we can provide the same substance use treatment service to under 18 years old. Right now, they're only providing 18 and older, but that is an option if there was a need.
Thank you very much. Are there any questions from any committee members? Okay. I see, yes. Xavier, please unmute yourself.
Hi, good evening, and thank you for being here in this space. It'd be helpful, I think, because we've been in the process of reaching out to all of our providers in the neighborhood to assess that and everything. How many people from the area are zip codes of 10029 and 10035 are you currently servicing?
I don't have
percentages. No.
Yeah, I don't have the information. We can look at who the current client population is and provide that. But yeah, I don't know that off the top of my head. I don't know, Chris, do you know that?
I see he put it in the chat.
Oh, he did.
Could you say that again?
I don't see anything.
80% from 10029, 20% from surrounding neighborhoods.
Copy. I don't
Okay, thank you.
see that. Okay, good, thank you. Okay, any other questions? I don't see that comment in the chat. Maybe it's something on my end. Let me close the chat and open it back up. Still don't see it. Okay, that's cool. Now, are there any other questions? Are there any other questions? I don't see any other hands raised. So with that, this is an action item. So I do want to open the floor right now to entertain a motion. There is a request for a letter of acknowledgement. They were instructed to come before us and inform us of this, and we are asked right now for a letter of support, and this is an opportunity for us to weigh in on that. So right now the floor is open for any committee member to entertain a motion. Again, any committee members? Is there a motion? This is the opportunity to speak up. If you're not, you don't necessarily need to wait until, someone makes the motion and then second it. But if you have questions, doubts, folks are on the line right now, there's an opportunity for you to get clear straight on anything. So I am further soliciting your participation here. Robin, please.
Thank you, Isaac. Given this question, do we not still have a moratorium on any discussion and any decisions regarding this kind of service impacting East Harlem? Are we not in a moratorium or not?
We requested a moratorium, but what is before us is not a new service being brought in. It's they're asking to continue the service they have been providing, just under a new license.
In that case, I would suggest that we entertain a letter of support for them to transfer their existing license in order to keep the program going. Thank you.
Thank you. Okay, Robin, repeat that for me because I want to read it back and see if we have a second. I'm sorry.
I move to provide a letter of support to Vita Family Services to transfer their existing license to, is it Cassia? Who are they transferring? Who was the license being
They are
transferred to?
transferring their existing license to operate programs through Prosema.
Through Promesa. Through Promesa.
Promesa, excuse me. Sorry.
Okay, so it's going from Vita to Promesa. So a letter of support to Vita Family Services to transfer their existing license to Promesa.
Okay, so let me read this back.
Hi, hold on. I'm sorry, Pastor Scott. I just want to make sure because people are having questions about this specific item. Are you guys seeing my screen? Are you seeing number one, informational update for this specific? Yes?
Yes, I see it.
Oh, okay. I just want to make sure. No problem. Go ahead.
I see it, yes.
It is asking for a letter of acknowledgement, and I'm recommending we give said letter.
Yes. So we have a motion on the floor to provide a letter of support to, excuse me.
Vita Family Services.
Yes. Yep. Just want to get my. Yep. So we have a motion on the floor to provide a letter of support to Vita Family Services to transfer their existing license, Oasis 822 CDOP, to operate programs through Promesa Inc. Is that correct? Do we have a second? April, can you unmute yourself? Is that a second?
It is. I'd like to second.
Thank you very much. Can we do the roll call, Marlene?
Sure. April Autry,
Yes.
Brandon Gillespie,
Yes.
Jennifer Meyer,
Yes.
Arturo Perez, Isaac Scott,
Yes.
and Robin Stration.
Oh, yes.
The motion carries.
Thank you very, very much. Okay, great. So
Thank you, everyone.
yeah, thank you. Thank you very much for your services and for providing so much of it to the 10029 community. We appreciate you.
Thank you. We look forward to continuing the service.
Okay. I have the language here for this to Marlene, if you want me to just send it to you so you don't have to redraft it, unless you already did.
I'm sorry, the motion language?
Yeah.
Oh, no, I got it. Thank you so much.
Okay.
I appreciate it. Thank you.
All right. Okay. So moving on. Second. Okay, so now we will have an informational presentation regarding the Public Health Solutions, New York City Smoke Free at Public Health Solutions. Public Health Solutions supports and empowers underserved New Yorkers and their families in achieving optimal health and building pathways to reach their potential. The NYC Smoke Free mission is to protect the health of New Yorkers through tobacco control policy, advocacy, and education. Stephanie, if you are on the line, you are free to unmute yourself and begin when you are ready.
Okay, hi everyone. Good evening. So yes, I'm Stephanie at New York City Smoke Free. It's nice to meet you all. Thank you for having me. I'm a little different. I have some slides. Is that okay to present for the record?
Yes.
For the meeting? Okay, perfect. So thank you. Just bear with me for 1 second. Okay, great. I will present so you guys can see. Oops. Okay, wonderful. So yeah, thank you, Pastor Isaac. So as Pastor Isaac mentioned, so we're Public Health Solutions. New York City Smoke Free is a program within the larger organization of Public Health Solutions. So eloquently, you've read our statement and mission, so I will, for time's sake, skip that. So as for our program, though, our mission is really to increase tobacco-free norms throughout New York City, especially because we believe that every resident has the right to breathe clean, smoke-free air where they work, live, and play. So we really, I've actually have had the privilege to have extensive work throughout East Harlem, and I think in accordance with that, there is a great need. You know, perhaps for our services, if we can, you know, reach the community at large for the catchment area where you work. So currently, this was pulled from the community health profile from the DOH. And current smokers, you may be privy to maybe the prevalence rate of current smokers, but as of right now, it's 18% in East Harlem. And in comparison to Manhattan, it's 13% versus 14% for New York City. So I think that's all. It's really important to highlight, you know, the information that you may be privy to, only to draw the picture for, you know, what kind of maybe services we can provide to your community. You know, and from smoking, there are personal and direct causes to health that can happen, namely chronic diseases such as heart disease, cancer, high blood pressure, things of that nature that I think are very much local epidemics within East Harlem. And speaking from just personal experience, having grown up in the Bronx, I think I can, you know, relate a lot of my personal stories and seeing how family members grew up. But also from, you know, from a bystander point of view, secondhand smoke is also pretty detrimental to our health. So there are more than 7,000 chemicals that are in secondhand smoke that are carcinogenic. Even the U.S. Environmental Protection Agency does classify those as Class A carcinogens. So they're just highly toxic. And there's, to the second point, which is on here, there is no safe level of secondhand smoke exposure, especially when we see high rates of asthma, COPD, emphysema in children and older adults. It just can exacerbate those conditions. And approximately, this is in the US, 41,000 deaths per year are attributable for non-smokers who are, consuming that secondhand smoke. So to speak directly to our programming here, on my side, we have a two-pronged program. So I'll quickly just touch base on the community engagement side where I work. So I'm charged with helping residences or residential communities and businesses go smoke-free through voluntary policy adoption. So basically, we provide the technical assistance, resources, and materials to help these spaces go smoke-free. So what they look like essentially is, we would, say, here we are, we're New York City smoke-free. And we would hope that by passing the policies, the benefits of a smoke-free environment would really help, promote the health and protection for all people who either live or work in those spaces. So, we first we touch base with the community at large to assess what kind of policy they want in place. And then do a questionnaire to follow that would then inform the policy to come. So, and just want to, as a disclaimer, I should have mentioned this in the beginning, but our services are free. We're really here as a resource for the community. We are backed and funded by the New York State Bureau of Tobacco Control. So we believe that these services should be accessible for everybody, despite, whatever situations that they live or work in. So that is for our work. See if I can go to the next slide. Yeah, so this speaks, this slide is shifting a little bit. My colleague, Ayo Ali, who heads our youth engagement program for Reality Check, couldn't be here, so I'm speaking on his behalf. But we do have a youth engagement program called Reality Check, which is also under the same grant that we receive funding from the state. And to give kind of a background on the youth engagement side. So you may have seen just walking around East Harlem, there are a number of, or the rise in vapes or vaping has gone significantly higher than the last few years. So the use of ENDS, so ENDS is electronic nicotine delivery system, that's what it stands for, is higher among high school students than adults in New York City. So with 43.8% of students having tried such vaping products and things. Again, most e-cigarettes may contain nicotine, but nicotine is also highly addictive and can harm adolescent brain development. So while they're learning, I think the last few years have spoken to, just the hardships of learning in a different environment, and then as a stress reliever, vaping can stand in as a coping mechanism. So we're really here just to tackle that. And really through our program, our youth really do manage to develop those leadership advocacy skills. This picture that you see here is a picture from our legislative day that we went to up in Albany. So we've met with a legislator up there. And so it's really just a great opportunity for youth to just, be peer educators on why, smoking is bad, and also to reduce the number of teens in their friend group or even their school community to stop or prevent them from stopping. So, and the eligibility requirements are any student from 13 to 18 can join the program. And it's also a free program. So I think just some tangible steps that we can propose to work with CB11 are really if there is an opportunity to contribute to like your newsletter or any email blast that may go out, we could contribute like a couple of blurbs about the smoke-free housing and the youth engagement work that we do. I also know that you have a youth committee. I would love to connect IO to that youth committee if possible, so that we can see how we can work together further in that regard. And then finally, if there is an opportunity as well to present at the full board meeting, would love to see if we could be a resource to the community at large. as well as get referrals from that. So yeah, I hope that's helpful. I know I flew through it, but just wanted to make sure there were any room for questions or answers or comments. And this is our contact information if you wanted to contact us further. So yeah, thank you so much.
Thank you, Stephanie. Could you go back to that last slide?
Yeah, of course.
I'm gonna use it as bullet points for
Yeah,
me real
yeah.
quick.
I've learned. Yeah, go ahead.
Yeah, no. I was gonna say, for the first point, we will definitely facilitate that. Would you want to do this regularly, or just is it just one time?
Yeah, I mean, I think we can do it however works for your community board. Would love to have an ongoing relationship for sure.
Great, and I would love to have ongoing updates in this regard.
Absolutely, yeah.
In regards to presentation at the full board, I do believe there's an announcement section that you can present in. Our committee chairs on the line who can let you know more about that.
Okay.
And there was something else, refer smoke-free housing. I had a thought about it. It left me. If it comes back, I will. But you know what? You have your information on the next slide. So
I do. This is our information for IO as well. Who?
Okay, great.
This is our youth.
Okay, so thank you very much. I appreciate you. I will be quiet and I will. Yes, Xavier, please help me.
I don't think you need any help, sir. But yes, we have our public session, which everyone is afforded 3 minutes. Typically, we recommend 2 minutes for your announcement, and then a minute for questions. And then if there's further interest, we perhaps could schedule something at a subsequent meeting. This one right now, just so you can plan, if you're going to show up, plan to be in person. The location is TBD. But I would recommend that you have some flexibility. The 30-day extension of emergency orders, we often find out a couple days before if they're going to extend. So if they do, then we'd be virtual as we are in this space, but otherwise I would be in person in that case. So thank you so much. And thank you, Isaac, Chair of our Human Services Committee, for running a great meeting, really enjoying it. Thanks.
Appreciate you. I remember now, Stephanie, Youth and Education Committee. I'm also on that committee. We met last week, Monday. But David Giordano is the chair of that committee, and I can't believe I'm losing our youth vice chair right now. But she's amazing. I can connect you with them.
Okay,
so
that would be lovely.
That way you can go and present next week. I mean, not next week, next month at the December meeting. Yes. Selena, yes, please.
Hi, and thank you for that presentation. I'm hoping you can, I know it was on a slide, but if you could put your contact info in the chat, that would be helpful.
Yes.
I just had a meeting earlier maybe it was last week, earlier this week is Monday, Lord. But anyway, the point is that there is something like 21, it's either 21 or 23 of the pop-up shops in East Harlem alone, the vaping shops that have been popping up. So I think this is a really important issue. And I'd like to, I definitely would like to connect with you and see how we can pass this message along in terms of, health, and the public health is probably a part of emergency preparedness. So I'm very interested in this, but it's something that everyone should be aware of, that there's a lot of these shops, whatever you subscribe to or prescribe to, but these vaping things do have high amounts of nicotine. And I think that people need to be aware of all the stores that are popping up here selling to our children.
Absolutely. I think that's a big issue. So I would love to connect. Yeah. Thank you so much.
Thank you. I appreciate you. Are there any other questions before we transition into our next presenter? Okay, so thank you very, very much, Stephanie. We will definitely be in touch with you.
Perfect. Thank you so much. All right.
All right. Okay, so we are going to keep this going. We're on good time, y'all. We're doing a great job. Happy about this, right? Everybody it's been a long day. It's Monday, right? Nobody want to be on the phone all day, right? So we're doing a good job. All right, so informational presentation. Our next one is going to be regarding health equity and access to care, HEAC project. This project is funded by the New York City Department of Health and Mental Hygiene as a response to their racial equity initiatives and interests about segregation that occurs in healthcare settings. So I haven't checked the attendance section, but do we have Dr. Romero and Elizabeth Figueroa on?
Yeah, I'm here, Diana Romero.
Hey, how are you?
Good, thank you.
Okay, you are free to begin whenever you are ready. Do you have slides that you would like to present?
I do. It says that I need to be given sharing. Here we
Yes.
go.
Yeah.
Great, thank you. Okay, let me move this out of the way. Okay, and I will definitely try to run through this quickly so that we can get to like any questions that folks have. And I know you're interested in, staying on track with time. First, let me just say I really appreciate the opportunity to present information about this project. Diana Romero, I'm a faculty member at the CUNY Graduate School of Public Health and Health Policy. And I'm in the Department of Community Health and Social Services. In fact, we're in Central Harlem, but we moved from East Harlem when we were still part of Hunter College at the 119th campus there, where the School of Public Health and Social Work was. So we're still in the neighborhood. I'm presenting on a project that is in the early days, and we're presenting across the city at community boards to really not only spread the word and let you know what we're up to, but more importantly, to get your feedback and to see how we can best include residents across the city. So with that, I'm going to talk real quick just to take less time and to leave for any questions you all may have. So I'm just going to put this first slide up here. Essentially, the health department did an analysis last year with quantitative data. Their hypothesis was that there was most likely segregation going on across hospitals in the city, not just, public hospitals, but all hospitals in the city. And they used New York State data, Sparks data, specifically focusing on the hospitals that serve New York City residents. And they found pretty much what they expected. They found that in this hospital data, people of color, people identified as Black, African-American, or Latino, Latinx, and or those with either no health insurance or Medicaid health insurance were more likely to be using the public hospital system or safety net hospitals. And those who identified as white and or had private commercial health insurance were more likely to be using private hospitals. So this was not a surprise to them. They had a sense this was happening, but they wanted to document to see if the quantitative data supported that, and it did. And their conclusion clearly is that there are differences in healthcare access, at least in hospital-based healthcare access across the city. And considering that just last year, the health department passed a declaration of racism being a public health crisis. They really felt that this issue falls very much in line with that issue that they're committed to addressing. So essentially what that analysis they did was able to shed light on what's going on, that there is segregated access to hospital care in New York City, but it didn't get at why that might be happening, what the factors are, what people's experiences are on the ground and in the hospitals. That's more qualitative. That's a qualitative question. And so they reached out to myself and some others at the CUNY School of Public Health to partner with them to get at that. And what I will say is that a few years back, I was fortunate enough to be involved in a project with H&H, where we actually did a series of focus groups across the city working with migrant serving organizations. CBO specifically serving migrant communities across the 5 boroughs. And we, at the time, were asking them about, and they had to be by default, not eligible for any kind of health insurance, and therefore potentially using the H&H program at the time, which was called the Options Program. It's now, as we know, called NYC Care. But we did a focus group across the 5 boroughs with migrant serving organizations to really get at whether they used options or if they didn't, why, and what their experience was. And I have to say happily that I believe H&H really used those findings to change their program, and the current version of that program is called NYC Care. But in any case, the health department asked us, about maybe doing something along similar lines. So what we just got started with this summer was the first phase of what's expected to be a 2-year project with them. And it is a focus group study. It's intended to recruit New Yorkers from across the city and to really get in-depth information from them in focus groups about their experiences trying to access healthcare in New York. And it's not just people who got services from hospitals in the city, it's also those who tried to but didn't. So we really want to get the full picture. And so we've only conducted maybe about a dozen focus groups in the last couple months, while we've been doing a lot of recruitment and outreach, like I'm doing today and like I'm doing most nights during the week. And we're basically saying, okay, so here we are at phase 1, where we are reaching out, and I'll show you in the next slide how we're doing that, but to folks who identify as either having private insurance, some form of Medicaid, or no insurance, and who may identify in these big, broad racial, ethnic categories. And they've been, signing up and doing these focus groups with us, describing their experiences with accessing healthcare. There are multiple phases planned, but this is a work in progress, and we're really interested in getting the feedback of communities to proceed in the way that makes the most sense. So none of this is really set in stone, but the next phase is intended to be more focused on migrant communities, non-US born New Yorkers, non-English speakers. So we would do them in multiple languages. The project I did a few years ago with in partnership with H&H and migrant serving community-based organizations, we did them in 6 different languages. So, we are poised to really reach out. And then, as you can see here, there are other phases. The health department was hoping to include other vulnerable groups with regard to healthcare, indigenous communities, unstably housed. That's how you started your meeting, talking about that particular group, formerly incarcerated, etc. But again, as a qualitative study project, as a community-based and community-oriented project, we're really interested in whether there are recommendations about other groups to be included and how we can go about, reaching out. So what we've been doing thus far, I've listed here. We have sent email notices to different CBOs across the city that myself and others at the School of Public Health have worked with. The health department has sent out information to their grantees and organizations they work with. We're hoping to meet with all the community boards across the city. We know the summer, there's no business really going on, like public business, but we're certainly trying to attend as many meetings as we can until we've hit all of them. We sent emails out, but I know, again, we probably need to continue to do that. We've met with several borough president office staffers. And as you can see here, we've also attended a number of citywide events, and we plan to do so. But the real question, the real issue is the last bullet on this slide, which is we're very nimble and flexible, and we really want to try to reach out in whatever ways that folks in the community think would be, best, and really reach as many New Yorkers as possible. I can stop sharing this and just show you one more thing, the flyer itself that we have emailed to folks. And, we're sharing this flyer various ways, but it basically shows that, to be eligible, folks have to be a New Yorker, have either accessed healthcare in the past year or tried to, and were not able to. Have, any of these health insurance statuses, different kinds of health insurance or not insured at all. Identifying, these sort of major racial ethnic groups. We also have an other category and can certainly accommodate that. Be an adult, majority age, 18 or older. This notation here about speaking English is just for the first phase, but we indicate that we collect information on other languages folks may speak so that we can keep them in the queue. So when we move to phase 2, where we're doing these focus groups in languages other than English. And we also indicate here that if people are interested and they don't have access to these focus groups are being done virtually for the moment, we may expand to, in person. But if people want to participate and they don't have access to sort of the internet and or, participation remotely, at the CUNY School of Public Health, we have a community space that can certainly accommodate. We can have people come and facilitate transportation-wise they're coming and allow them to participate that way. These are 2-hour focus groups. We are providing, some form of compensation for their time. It's via cash, cash apps, so they get it within 24 hours. And this link here, I'll drop in the chat my information and the link. The link is to a quick screener survey where they just answer a few questions so that we can determine if they're eligible, and then we can follow up with them to actually schedule the focus groups. But this is, we've sent this via email. I believe we sent it to all the community boards. We can follow up again. Some have included it in their newsletters or their email blasts. Some borough president's office have done the same thing and or shared it through social media. And we have a version of this that is more conducive if you want to send it out through social media. But this project will be going on, again, assuming the funding is there, because from one fiscal year to the next, there's always that caveat, with the health department, assuming that the funding is there. We will be, continuously recruiting and trying to do outreach to get as many New Yorkers in this as possible. The last thing I'll say is that their ultimate goal is that any barriers or factors related to whether New Yorkers are or are not able to access healthcare in different hospital settings across the city, the health department wants to use that as evidence to inform policy recommendations they make going forward to hopefully eliminate this sort of what at the moment is segregated care. So they're really committed to having this inform recommendations, and it is being funded out of the Bureau of Equitable Health Systems, which is in the Center for Health Equity and Community Wellbeing. So it's very much in line with their mission. So I'll leave it there and I'll put the information I mentioned in the chat, and I'm happy to answer any questions.
Diane, I just want to say that I love every part of all of that information you just shared. Thank you so very much. I had thought about some in-person recruitment you could do. I was just thinking it'd be great if you if not you personally, but if the recruitment staff visited churches, because there are a lot of elderly people at churches who can definitely testify to some of those experiences. Young and old, people are coming to the church for a lot of different reasons, and I'm positive that you definitely get some people signed up there. But specifically, we can connect, and I can speak with my pastor, Reverend James, to ensure that we can at least get, maybe if on a Sunday there's like a table in the vestibule where you guys can just like sign people up for the focus groups after service when people are coming out. I can speak to him about that, but we can make it happen. It's just a matter of when.
That would be really, really wonderful. I have to say I'm really privileged to have as a colleague. Oh my God, why am I blanking at the moment? This is very embarrassing.
That's okay. Don't worry.
We have the Harlem Health Initiative at the CUNY School of Public Health.
Okay.
And Deborah, why am I blanking on Deborah's name? Because I work with her all the time, but she runs the Harlem Health Initiative and is very much in touch with, you know, community-based organizations, faith-based organizations, you know, various institutions across the city, but certainly in Harlem as well. And so, you know, I think that that's very much in line with, you know, a lot of the work that she engages in as well.
Good. The other thing I had was some questions. What is the frequency of the focus groups and how many people are in a focus group?
Yeah, so, you know, we are equipped to conduct several focus groups a week, but in the screener survey, and I included the link in the chat there so people can go into it and see what the questions are. We ask people at the end to indicate their availability just in general, and it's 7 days a week, and it's at least 3 segments across the day. So in the morning, in the afternoon, and in the evening. We really want to make it so that it can accommodate, you know, most people, if not all. And our you know, team are poised. We've done focus groups on the weekends. We've done them in the evenings, you know, at these different periods of the day across 7 days. So that, you know, we really want to accommodate people's availability. In terms of the number in a focus group, we've actually found that in the virtual, you know, space, fewer is better. Like if you gather a bunch of people in person around a table, you could do, you know, 8 people, that's great. Virtually, it's harder. So it tends to be more like around 4 or 5 people.
Okay.
And, you know, those who participate really, they want to talk about this. And so it's really, you know, it's very valuable.
Thank you very much for that. Yeah, that sounds about right. I was wondering, like, how comfortable are people talking about this in a virtual space? So yes, it makes sense that groups would work best if they're smaller. Yeah, thank you for that. I'm going to on my own make sure that I follow back up with you about possibly coming over to our church to just talk to some folks. I give also following this meeting, I usually give updates, community updates at the church. So I'll include this in my updates.
That is wonderful.
Yeah.
Well,
absolutely.
Pastor Scott, I can certainly follow up with you as well and send the flyer. And we have, you know, printed out color copies of it when we've done the in-person tabling. And we can also, you know, set up either drop copies off. I mean, we could do that as well if that'll help with your announcing it to the congregation. And I mean, it would be wonderful. Again, we're going to any and all in-person events as well. I will say that at a CB that I presented at last week, you know, the senior population was also described as you know, a group to tap. Now we know we have the Medicare group as like a separate separate phase, because that is a very different kind of health insurance that people have as apart from others. So they would fall into that. But of course, it was pointed out, you know, like there are differences in terms of facility with technical, you know, with logging on to you know, a website, or even scanning the QR code we have. And so when we table in person, we bring like a laptop or a tablet with us to assist people doing it right there on site. So we're totally, you know, aware of that. And it was, you know, emphasized that they may feel much more comfortable in person around a table doing a focus group than virtually. And, you know, as a School of Public Health, we're also still very cognizant of the risk of COVID. So we're trying to balance what's more comfortable for certain groups, versus what might be the safest in terms of exposure to not only COVID, but now it's flu season. So we're trying to balance that.
This is amazing. I'll be quiet now. Is there any questions from any other committee members? Entertain some hands from the committee members, and then we see if there's any hands in the attendee section. No questions? Okay, April, please.
Yeah, thanks. I don't really have a question, just a thought, because I'm also in public health and a medical provider by training. And I know there's a lot of health disparity, particularly among Black women and childbirth and pregnancy. And so maybe thinking about expanding, because I don't know if, like if someone's a mother and they're taking their child, if they could participate and like accessing care for a dependent, for example, or even postpartum things. I think there's an opportunity to work with lactation consultants and how did you feel postpartum or even during your pregnancy and accessing care, because there's just such clear, health inequities there that I think it's an important population. And especially when you're talking about mothers, one that really wants to advocate not only for their own health, but the health of their children.
I really appreciate that comment because that could be a very valuable sort of, modification to our eligibility process. Right now, we're asking folks, did they themselves access healthcare in the past year, or did they try to and weren't able to? In the focus group, one of the questions, the questions that ask around their experiences accessing healthcare has like a follow-up to it, which is if they, what experiences they may have had trying to access healthcare for someone else, for a family member. But the truth of the matter is the only way we get that information is if in the screener, they had accessed healthcare for themselves. And I think you make a really good point that if we have it as an eligibility criterion that it's either themselves or for someone else, it probably would bring in, a really important group, which is parents accessing healthcare for their children and or children accessing healthcare for their older parents, right? So I really appreciate that. I think that's would be a really viable change we can make. Yeah.
Thank you, April. Any other questions, comments, concerns from panel, from the committee members, or from anyone on the phone? Anyone listening to this presentation have a thought, comment, feedback, question?
Hi. Yeah, I have a comment.
Yes, go for it.
Oh, hi. Yeah, I work for the Department of Health, but the state arm. And I just I also do maternal and child health. I'm in the Maternal and Child Health Bureau. And I just wanted to echo that this is really exciting. I actually used to work for the CUNY School of Public Health, so I just wanted to say that this is really exciting. And I'm happy to hear that it's going on. And I'm also a resident of the CUNY board, so this is a meeting of the minds.
That's great. And your name is very familiar to me, so now it makes sense.
All right. Yeah. So yeah, I was gonna suggest oh my God, community gardens, but it's too cold now and the season's over. That was my first thought to recruit, and also to simplify the flyer, but that's it.
So since this project is going to be going on, for the next 1 to 2 years, we could certainly put that on our, plan, our timeline for recruitment come the spring and summer.
Yeah.
So,
there's a lot of community gardens in Harlem, and yeah, and they all have discrete groups of people that are a part of them. So that I think that that's like an easy way to get a you know, group of a population that's going to catch your interest. They're going to be interested quickly, I think.
That's excellent. Thank you.
Yeah. So the you know, Grow NYC website.
Okay. Thank
Many
you,
thanks.
guys.
Yep.
No, you good? Thank you very much. I appreciate you guys. Diane, thank you very much, Diana, excuse me. Thank you
Okay.
very, very much for such a thorough presentation. We are definitely going to be in touch. So this is like a see you later. I really appreciate all of the work you guys are doing. This is great. This is great for so many reasons that I won't go down along. I won't start ranting. So
Thanks. Well,
thank you.
I remembered it's Deborah Levine, who I've been working with in the Harlem Health Initiative, the CUNY
Okay.
SPH. And
Okay.
so, but yes, I will follow up offline. I appreciate the time given, everyone's input, and certainly Pastor Scott, your offer, you know, with these very concrete next steps. So I really appreciate that. Thank you.
Okay. Thank you. Thank you. Oh, hold up. I'm sorry. We had one more, Marianella. Did I say that right?
It's Maria Elena. Thank you so much.
Elena.
I just wanted to share with you guys. I'm so excited that it was brought out the maternal, you know, the concerns about women and the lack of access sometimes. I work for an organization, a CBO in Harlem, and Northern Manhattan Perinatal Partnership, and I think that it will be great to collaborate with this project because there's a lot of mistrust sometimes from community members to, you know, give information. But if it's through an organization that is known to them, I think it will be easier for them to trust sharing information and also the access. A lot of the families that we work with, that they don't have access to a lot of technology, or they don't know how to. And so I think it will be fantastic if we can connect. I don't know if I should just share my email address in the chat, but it will be super exciting to hear the stories of some of the undocumented families who don't speak English, they speak some other language, and the lack of access that they have, even with the simple things. And so this is really exciting and important to address. Thank you for that, Dr. Romero.
Thank you. I will look for your email and also follow up with you. I appreciate that. We have, as a school, have done work in the past with the Northern Manhattan Perinatal Partnership, and so that's great to sort of, you know, have your assistance in maybe spreading the word there as well. I appreciate that.
Dr. Romero, thank you very, very much again for your presentation, and we will be in touch. Okay, so that concludes our presentations for this evening. Very, very, very informative and exciting announcements and presentations this evening. I'm very much psyched up about some things. I'd love to get information like that, to know stuff like that is happening. You know, that goes a long way to, you know, offsetting inequality. So this is exciting to be able to contribute to. Old business. So if I will take you, if you will travel back with me to the September meeting, which was quite a doozy. You know, we had the Department of Health and Mental Hygiene on. We had a bunch of questions for them. They were not able to answer those questions at the moment, but they did. Pauline Ferrante did work tirelessly, and she got us some responses to those questions. So I'm going to share my screen, if that's okay, Marlene, and I'm going to just walk us through these. I'll read them so that they're on the record read. but they'll be on the screen if you want to follow along if you're on a computer. I know everyone may not be on one, so I will read these out. It's about 5 pages. All right. Let me get some water before I read this. All right. I'll be right back. That one right there. Thank you, sir. Appreciate you. Okay. So these questions were in regards to the overdose prevention clinic on, I believe it is 126th Street or 7th Street, 26th Street, between, I'm going to say Lexington and Park Avenue. I think I have the streets correct, but it's that area. Okay, so question one. I'm just going to go through this. I'm not going to stop to answer any questions or entertain anything like that, just for the sake of time. Also, I really can't answer any questions off of this. This is the responses we were given. So I'm just going to read these off so they're read on the record. But also, if you would like, well, I'll talk to Marlene about how we can get folks access to this if it is able to be given to everyone. It's public on the record, so I guess we'll figure out. Yeah, I guess you can email me and I'll send it to you if you want a copy of this, but you have it on the record. Okay, why was East Harlem specifically selected as a location for the OPC? The first OPC sites were opened based on, oh snap, I'm not sharing screen, sorry y'all, my bad. All right, I can see my screen. I can't see anyone, so if someone could just say yeah, that would be great.
Yes, Isaac.
Thank you very much, Robin. I appreciate you. Okay, cool. Why was East Harlem specifically selected as the location for the OPC? The first OPC sites were opened based on program readiness and neighborhood need. These providers have served these communities for a long time, and this is an additional service they can now offer to save lives. We hope to see more OPC sites open in other areas of the city soon. Next question. Given the number of substance abuse treatment services already located in Manhattan Community District 11 and particularly concentrated in the immediate area of East 125th Street and Park Avenue, what reasons other than NYHRE, now on point, being located on 126th Street, was there to approve the sitting of this new OPC there? In response, in New York City, there were 2,062 overdose deaths in 2020, making it the deadliest year of the overdose epidemic since reporting began in 2000. In the first 3 quarters of 2021, there were 1,956 overdose deaths, and when the data is finalized, 2021 will be the deadliest year on record for overdose deaths. This increase is being delivered by the proliferation of fentanyl in the drug supply. Large disparities in overdose death persist in New York City. Neighborhoods such as the South Bronx, East Harlem, and Central Harlem, which historically have been disproportionately impacted by overdose deaths, have endemically high overdose rates that have continued into 2020. These neighborhoods are also among the neighborhoods hardest hit by the COVID-19 pandemic. In East Harlem, the OPC is a place-based response to the high overdose rate in this neighborhood. DOH-MH supported the opening of OPC services within existing harm reduction programs with longstanding and deep ties to the communities they serve. Next question, by what specific metrics is the effectiveness of overdose prevention center being measured? Since opening in November 30th, 2021 through September 18, 2022, the 2 OPCs operating in NYC have had a total of 36,668 utilizations by 1,775 unique individuals, and staff have intervened 500 times to prevent overdose-related injury and death. DOH-MH is working with an academic institution to examine the impact of OPC services on various metrics, including overdose deaths, non-fatal overdose, emergency department utilization, referrals to healthcare, and community concern such as public drug use and syringe litter. I wonder what that academic institution is. Not asking, but I guess that would be a question I would ask. Next question. How many individuals have been served by the OPC since it opened in fall 2021? How many reside in zip codes 10029, 10035, 10037, or 10128? How many reside outside of these zip codes? Please provide the number of individuals being served by zip code. We do not have data on the zip code of residences of OPC participants. Please see above for OPC utilization information. Next question. Statistics demonstrate that the Bronx and Staten Island possess the highest appointment of overdoses in the city. Why were these sections of the city not addressed first? The first OPC sites were opened based on program readiness and neighborhood need. On Point in East Harlem, formerly New York Harm Reduction Educators, has served and provided necessary services to the Harlem community for decades. The OPC is one of the many services offered by On Point. Okay. On Point continues to provide crucial support to Harlem residents during an unprecedented overdose crisis, which has disproportionately affected many neighborhoods, including Harlem. East Harlem and Central Harlem had the 4th and 6th highest overdose rates of any neighborhood in New York City in 2021, 50.1 and 49.2 per 100,000 residents, respectively. So give or take, respectively. Okay. We hope to see OPC services expand to other areas of the city, particularly neighborhoods experiencing high burdens of fatal overdose. However, no plans have been finalized at this time. I just want to, I know I said I wouldn't do this, but I do want to just point your attention to the fact that this was mentioned twice now. The first OPC sites were open based on program readiness and neighborhood need. For what it's worth, that was mentioned twice in 2 different questions. This community has long voiced its concerns about the number of support services cited in this district, despite it being understood that the needs these services are designed to address are present throughout the entire city. A disparate number of such services are cited in communities like East Harlem. This is further exemplified by the sitting of the new OPC in this community. How does DOH-MH justify its support for the continuing concentration of these services in CB11? The OPC in Harlem is housed within an existing syringe service program with longstanding ties in a neighborhood that provides crucial life-saving services. From November 30th, 2021 to September 18, 2022, more than 1,300 individuals have used the East Harlem OPC site. Staff at the East Harlem site have intervened more than 200 times to prevent overdose-related injury and death during this time period. In 2020, fatal overdose rates in Harlem far surpassed the citywide average, 51.0 and 49.2 per 100,000 residents in East Harlem and Central Harlem, respectively, compared with the citywide average of 30.5 per 100,000 residents. We agree that this is a need across the city beyond Harlem, and we hope to see OPC services expand throughout New York City. Regarding other programs, we support several initiatives to increase the accessibility and availability of substance use disorder treatment throughout the city, including but not limited to medications for opioid use disorder, i.e. methadone and I can't pronounce that word, y'all, but y'all see it, right? Don't make me do that, okay? Methadone and we'll say that word are the first line treatment for opioid use disorder, and we are committed to ensuring these life-saving medications are widely available citywide. All jokes aside, does anybody know how to pronounce that word for me though? Any medical experts on the phone who could help? Okay.
I think it could be buprenorphine.
Go ahead, Robert. You get like 1,000 points for that. Thank you. I'm not going to try that, but I appreciate you. Next question. Is it the position of DOH, MH, or the city administration more broadly that there is a disproportionate number of East Harlem residents that require these services compared to other community districts? If so, please provide specific data to support this claim. The first OPC sites were opened based on program readiness and neighborhood need. As mentioned above, residents of East Harlem and Central Harlem experienced a disproportionate high rate of overdose deaths compared to most other neighborhoods in New York City in 2020. East Harlem and Central Harlem had the 4th and 6th highest overdose rates in any neighborhood, any neighborhood in New York City in 2020, 50.0 and 49.2 per 100,000 residents respectively. Okay, so defer to Oasis about treatment data. Okay, give me 1 second there. Was consideration of the impact to the local residents included in the deliberations and decision-making process with citing the OPC and other services in CB11? If so, please elaborate. We are committed to community engagement. Representatives from the Division of Mental Hygiene have met with the community board and other local stakeholders, and we value input from the community. We are focused on the impact of overdose epidemic and how to mitigate these impacts. Residents of East Harlem have consistently had among the highest rates of fatal overdose, and OPCs are an evidence-based intervention to reduce overdose deaths in the neighborhoods where they are located. Excuse me, next question. There exists a daycare and schools. There exists a daycare and schools along the Section 8 housing in the immediate vicinity. Did discussion occur with the short, mid, and long-term impact to this section of CD11's community health profile? If so, what were the metric-based conclusions? The OPC is housed within a syringe service program that has served this neighborhood for over 20 years. This is an additional service in an existing program. In addition, substance use treatment programs, as well as harm reduction programs, are health and care facilities that promote the health of the people they serve. As such, these programs should be treated like similar facilities in the community. There are no certification criteria for OASIS that prohibits a program from being located near a school. Okay. Yeah. I'm gonna circle back on this whole thing right here. Yeah. Okay. I'm gonna leave this alone right now, but yeah, that presents a lot of issues. Ones that I didn't see the first time I read this. Our work is driven by overdose, next question. Does DOH-MH support the idea that services should be provided equitably? And if so, how does it justify the apparent disproportionate sitting of these services in CD11? Our work is driven by overdose data, which shows deep disparities in overdose deaths. We take an equity-based approach in which we focus on initiatives in areas that experience the highest burdens of overdose deaths, which includes East Harlem and Central Harlem. The health department relies on overdose data and community health profiles when assessing community needs and providing recommendations on treatment certifications applications. While the health department provides recommendations and consultation on substance use treatment certification applications, programs apply directly to New York State Office of Addiction Services and Supports, OASIS, and they have final authority over site approval. Okay, so this is a point of accountability. Just want to, I hope folks are, also taking notes on this. These are points of context, because we see the burden being shifted here. We share a goal: making services more accessible and acceptable to people. We are committed to finding ways to bring services to all New Yorkers, regardless of where they live, and reducing wait times and any unnecessary travel if possible. Next question. Has DOH-MH studied the impact of disinvestment on communities and its correlation to the need for support services such as substance abuse treatment? Disparities in overdose deaths are largest and most evident when the numbers are disaggregated by neighborhood. Did I say that right? Disparities in overdose deaths are largest and most evident when the numbers are disaggregated by neighborhood. Areas such as the Bronx, East Harlem, and Central Harlem, which have been historically disproportionately impacted by overdose deaths, continue to have high rates of overdose in 2020. These high rates follow years of disinvestment, and patterns reflect structural inequalities in the social determinants of health, such as wealth, employment, education, housing, and criminal justice system involvement. We are committed to readdressing these harms and addressing racial and geographic disparities in fatal overdose. Our support for opening OPCs in neighborhoods experiencing high burdens of fatal overdose reflects this commitment. OPCs are a place-based public health intervention that has 30 years of evidence demonstrating their efficacy in reducing overdose deaths and improving community safety in the immediate area where they operate. Next question. Has DOH-MH reviewed the community impact since the siting of OPC? DOH-MH is working with an academic institution to examine metrics such as overdose deaths, non-fatal overdoses, emergency department utilization, referrals to healthcare, and community impact on public drug use and syringe litter. New questions. How many more questions we got here? Sorry, y'all. All right. New questions. Why wasn't there a response to our initial questions? Oh my gosh. Why? DOH-MH responded to a letter from Manhattan Community Board 11 last year, which covered this topic. Was consideration given to the local schools? The syringe service programs and DOH-MH have had ongoing conversations with community boards, elected officials, and other community leaders about the need and impact of the OPCs. These programs have longstanding relationships with the communities they serve. Research shows that OPCs provide many positive benefits for their surrounding communities, including a decrease in syringe litter, as well as a decrease in drug-related crimes, such as drug solicitations, public injections, and drug sales. I think this is an important one. I'm gonna reread this one. Just in case people wasn't listening, because this has been this has been the emotional or empathetic point folks have been trying to leverage to, advocate against, I want to say these clinics. I'm gonna boldly say against, because that's what the advocacy appears to be, against it. And this has been an anchoring point. What about schools? So what consideration given to the local schools? The syringe service programs and DOH-MH have made ongoing conversations with community boards, elected officials, and other community leaders about the need and the impact of OPCs. These programs have longstanding relationships with the communities they serve. Research shows that OPCs provide many positive benefits for their surrounding communities, including a decrease in syringe litter, as well as a decrease in drug-related crimes, such as drug solicitations, which is drug dealing, public injections, and drug sales, or requesting drugs, rather. Same thing, drug sales, drug solicitations. So just wanted to repeat that again, because this is their rebuttal to, concerns that were made by committee members. So again, just wanted to highlight that, pin that. Next question. The claim that complaints, the claim that complaints about needles refuse, it's late, y'all, I'm sorry. The claim that complaints about needle refuse played a part in the decision. Were other neighborhoods given the same analytical consideration when compared to overdoses? Okay, I understand that. Okay, great. Our main priority was to address high rates of fatal overdose in the most impacted neighborhoods in the city. However, research shows in addition to preventing overdose deaths, OPCs also reduce syringe litter in the neighborhoods where they operate. We continue to advocate for the expansion of these life-saving services citywide as an evidence-based strategy to prevent fatal overdoses and reduce public drug use. I'm going to language as we are listening to this, they are, referring to the research and the information that they are using to make decisions as evidence-based. So it is important that in our rebuttals, they be also evidence-based, or at least to the point where we can, prove that the data they're using is incorrect, inconsistent, or it has confounding variables that they haven't considered. So just a note there. Next question. Has DOH-MH researched the impact on the, before I say that, sorry, y'all. Also, I hope that this doesn't also just, these answers, I'm hoping that we're not just thinking the rebuttal, but also that we can become more informed by the folks who, are, doing this work and giving us these answers. So I hope that we can balance the information that we're receiving as informative enough to inform our advocacy, but also as informative enough to inform us in our ignorance. And I will say that, inform us in our ignorance, because there's information here that I'm sure, everyone on this phone didn't know, prior to reading this or being exposed to this document. So I do think that we should balance this information that we're receiving as we take a position as a committee, as a community. Next question. Has DOH-MH researched the impact on a daily basis, the needle refuse since inception of the OPC. DOH-MH is working with an academic institution and on point to evaluate the impact of OPCs on various public health outcomes such as syringe litter and public drug use in the surrounding area. Since opening, the OPC sites have diverted 600,000 units of waste, including syringes, alcohol swabs, etc. Next question. Has DOH-MH reviewed the increase of needle refuse as disclosed by multiple groups since the inception of the program and the law change? We take concerns about syringe litter very seriously. The city has invested considerably in evidence-based strategies to reduce syringe litter. For example, the city has increased funding for outreach and syringe litter (OSL) teams to pick up syringes in high need areas, including sections of Harlem. Additionally, the city has provided funding for additional syringe disposal kiosks, which provide a safe and anonymous place for people to dispose of used syringe. Thirdly, the OPCs divert syringe litter by providing supplies for clients and giving them a safe place to dispose of used supplies. Next question. According to NYHRE, they claimed they were willing to present in October that the program was coming online at the end of the year, but were instructed not to by DOH-MH. Knowing this now, why did DOH-MH knowingly obstruct public dialogue and subsequently equivocate? On October 18, 2021, DOH-MH presented to the CB11 Human Services Committee on the topic of overdose data, harm reduction, and benefits of OPCs. At that time, as was stated to the committee, no definitive decisions have been made about the locations and operations of an OPC in New York City. We appreciate the opportunities to speak with members of your board and your office about OPCs and the benefits this site will bring to the community. I guess I'll say this publicly, period. I think one of the things that just came to mind in my own, stumbling through some of the language here, a lot of it is jargon. And I think it's important that for the sake of, sometimes, language can be excluding sometimes, sometimes folks, don't have the vocabulary to understand a lot of some of what's being said. So I think sometimes when we frame some of these questions, we can just be a little more considerate of who will in the future hear, these questions and these responses. So that's just a note to the world. I'm just going to say it that way. Because just in reading this, I feel like a few people or somebody might read this or see this later and like, what the heck does that mean? And we, if this is to be inclusionary, then we got to ensure that we're using language that's not, that you didn't need to go to school for. You didn't need to, y'all understand where I'm going with this. Just respecting folks who attend meetings who may not be as literate as other people. So I'll come out of that now. That's just a note that I want to just leave with us. Next question. Why did DOH-MH approve a program that was illegally engaging, enabling in drug use activity at the federal level as admitted privately and publicly by the executive director? NYC DOH-MH seeks to protect and promote the health of all New Yorkers. Nationally, the number of drug overdose deaths more than quadrupled between 2000 and 2019 and continues to grow worse with every passing year. In 2020, over 2,000 individuals died of a drug overdose, meaning that a New Yorker dies of a drug overdose every 4 hours on average. More New Yorkers die of drug overdose than homicides, suicides, and motor vehicle crashes combined. The urgency of this crisis necessitates a response that is rooted in evidence. Overdose prevention centers are an initiative that has seen immense success across the globe in preventing overdose and saving lives. In late 2021, the Board of Health published a statement in support of establishing OPCs. The statement endorsed New York City's Department of Mental Health's action to support OPC operation and urged the federal government and New York State to provide authorization of OPCs and continue to expand funding for harm reduction services. And they provided us with a link to the entire statement, which can be provided to anyone who wants to. Let me see something real quick. Copy link location. Let me see if I can do something real quick. Paste. Okay, so I just pasted the link to the entire statement in the chat if you would like to read it. Final question. Of those claimed to be 100% from our zip codes, who are from Randall's and Ward's Island? At this time, we do not have this information. And I think this is consistent with a similar question they answered above. So I will stop sharing screen. We have this now on the record. It has been read. I would, for a minute or two, entertain any thoughts, comments that anyone wants to just put on the record as it relates to anything that was read or anything that I said while reading it. Yeah, the floor is open, please. If you have anything to say, please raise your hand. Robin, please, thank you.
Isaac, you're very welcome. It's very easy. I think there's validity in some of this, but it's hard to say where, because this organization doesn't have to be transparent with us. We're not funding them.
Yeah.
And I think that this text can come very easy. On the other hand, I appreciate what you say in that if we're asking them to be, answerable to us, maybe we have to prove to them what our complaint really is.
Yeah, evidence-based, I think, and that's why we talk about doing research and getting the data. But I think from what I think we got a lot more than we had from them. So I think with that, we can then move forward to, sort of think about what steps or what steps we want to take. How do we want to respond to some of these things? What information do we want to seek out before we respond? They mentioned working with an academic institution. What academic institution? We can find that out and possibly, just learn more about that relationship and the type of data they'll be collecting, how they'll be collecting it, things like that. So, I think all of this goes a long way to informing us more on how we can move forward. Yeah. Cool. Jennifer, please.
Yeah, just 2 points. I think one, it's very unfortunate that they weren't able to provide any data based on zip code like that. I think is a critical piece that we would really need, and especially that was very disappointing. And second, I think also maybe somehow stressing to them, I'm a big fan of research. I teach research to social work students, but lived experiences can also be research. And when we're telling them these are the experiences of folks living in this neighborhood, I think somehow we need to make that into research for them, or find research related to that, because it's not going to be the typical research that we see in papers maybe, but it doesn't mean it's less valid or less important that we're all in the community saying this is what's happening.
So we have the capacity to partner and create a qualitative study that does gather lived experiences, Jen. You know, so like that is exactly like something that I was trying to hit at before, and that we should design our own studies in partnerships with academic institutions and local organizations and community partners to also have data and see if the data is actually, you know, saying, is it saying all of what we're hearing, you know? So I agree with you. I do agree with you. We should really circle back on some, and that can be, you know, what I wanted to talk about in the new business section. That can be one of the goals we have for 2023. What study do we want to create? You know, so we can start to gather our own data, you know, so we don't have to be dependent on everyone else's data, you know? Xavier?
Hi, thank you, Isaac, very much for putting this forward. It was a bit of, took a while to get a response, well over a month, despite them having the questions in advance. And I just want to be very clear for the committee. Dr. McCrae had these questions in advance. It was disclosed that he had answers, but it took well over a month to get them delivered to us, which we later discovered that they didn't actually have a response ready for us, which is why the September meeting was found wanting. I'd like a couple items to go through if you've seen, and just for those, and not at the risk of sounding pedantic or like I'm like lecturing or whatnot, is not the case. It's more about if you see a repetition in the response, even though there's a different question asked, that's because they don't have the information to provide. And that's just, you know, it's unfortunately what we've seen, and not just with this agency, but multiple agencies throughout the city. That's been very disheartening. I think that, again, is a data-driven process, and I appreciate you, Isaac, for reinforcing that. I think there are a couple things we should start to separate. That the On Point NIRI, as they've rebranded and renamed, they do receive funding from Oasis for separate services that are being provided in-house. So it's important to recognize that. They also receive private services, which are or private funds that provide these services for the OPC. And those funds are, although they're supposed to be separate, because it is all internalized, it is hard to really account and have a reconciliation of how everything is appropriated. So that's something that should be addressed. Data driven, I think, for all of us, because again, as a community that has been greatly impacted from the 70s, 80s, and early 90s with drug use, and now again, if you take to note question 5, as they address the stats on East Harlem, Central Harlem as 4th and 6th highest, notice that they're aggregating those two, whereas they remove number 1 and 2, which are Bronx and Staten Island, which are significantly higher. And that's something that is the committee, as you as a committee start to break down everything, it's important to look at that. And if you see the common thread, one thing we walked away with Dr. McCrae was that it's about readiness. They notice how they prefaced that it was ready, ready, ready. And the other, I think I forwarded to you, Isaac, the DOHMH white paper, which concluded why they were going to go forward. And I think that if it hasn't been shared with the committee, it should be. I'm going to try to pick up speed here. I apologize, but I think it's important that when we dive into this as a committee and as a board, that we realize that this was less about where it was needed, but more about where it was ready. And that if you note the old saying, the devil's in the details. Notice they say that they want to expand, but there are no plans. They want to expand, but there are no plans. And even Dr. McCrae stated that. So I think that's something that we need to, the repetition of information, despite a different question being asked, is nothing short but the fact that they don't have the data to support, other than the fact that it just was about readiness, not about need, full stop. The other bit, hold on, I'm going to mine. And I like how you called out number 25. Wait, it's 25, hold on. XI, V, right? You know, Roman numerals. No, that would be 14. The Department of Sanitation, DOS, has noted an increase in syringe litter, not a decrease, an increase since the sighting. And that data is available. We have seen a notable increase, not just in the neighborhood, but around schools, et cetera, and so on. Again, it's about what has happened now is a company or a firm. They've created a self-sustaining model business-wise, but I would implore this committee to continue down the research to see how they're getting funds from the state side. They've separated. It's kind of like when a company creates a profit and for-profit held within, but they're separate and apart, but they're all working together in tandem. So I think it's important because ultimately, and I love how you called it out, Isaac, about the issue that they're not addressing the schools and input, because when we give a liquor license, it has to be X amount of yards away from a school. That's a reality. And we can say no to that. And SLA will say no unless there's an extreme exemption to it. So I'd really implore the committee to look at this holistically, because ultimately we desire, I think, to stop perpetuating the problem and help people heal. That's ultimately what it's about. We've all, many of this committee, and I'm sorry, I'm being a bit long-winded.
You're good. You're good.
Many of us have been impacted by substance abuse, or families directly. We've intimately dealt with it. But again, we could either subdue the symptom or cure the cause. And I think for us as a community board, I implore us to get into the weeds, go through the details, get the stats and data, and really dive deep. And I think that's important that when we look at things, is it of medical necessity or was it because of political ideology? And if you share that study, the conclusion is laid bare from DOHMH. So I will leave the committee. Thank you. I applaud this work. You all are, I hold you all in high regard, and thank you so much for being in this space. And I just can't wait to see you all in person. So and to do this work together.
Thank you, Chair. I appreciate you saying all of that, because it does give more context, and it also helped me to think a little bit more about how we can begin, going deeper into interrogating a lot of what it said, because I think there is like the balance between the political interests and them understanding the high overdose rate in East Harlem and saying, well, you need it, so we're giving it to you, and trying to use that where there was a lot more behind it. So I definitely understand and can see the BS, but I think it's like we got to know what I think we just got to come correct and know what we want, and I think that takes us getting a little bit more informed on how this is happening, what's been happening, and what they plan to be doing, because they planning something. So we got to know there's a lot of building and happening in East Harlem. So, we just want to be ahead of things. Yeah. Thoughts, Jen? I saw your hand up. I'm sorry.
Isaac,
that was you. Go for it. I'm sorry.
That was me. So real quick, I love one last remark. Sorry, I pulled up the PDF and had my notes up. The last bit and bob is that the academic institution, academic institution? They've been, On Point has been carrying on with meetings with other groups within the communities that they affect, which is both 10 and 11 in this particular instance. They haven't disclosed, nor has DOHMH disclosed. They have been caught. Sam Rivera was caught on record, and I paraphrase, saying that, well, we're not collecting the data whether they reside here or not, and that is affecting the input. And they're going to count people who are just crashing here in the neighborhood versus where they're domiciled and receiving their mail, or they have a legal apartment. So they're including anyone who's just existing here. that was something that was of issue. And then finally, I would recommend this committee reaching out to the 25th precinct to find out their interactions, because and last conversation during a meeting at the 2-5, many of those that are in the community are not from here. They're from outside the zip code. So that I think it's very important to address as well. But I implore the community.
I'm sorry, that would be based on like the address they give when arrested?
I do not know, but I can get you connected, Officer Pescatori from the 2-5.
Thank you. Thank you.
Thank you.
Definitely. All right, y'all. Any other thoughts and questions, comments before we get ready to get out of here? No? Okay. I see Susan Burke. If you are able to unmute yourself, please go for it. And Tamika, I see.
Can you hear me?
I see you, yes, and I'm gonna and I see you, Tamika, as well.
Okay. I don't know if this is important or not, but the Neighborhood Block Association last Tuesday had Sam Rivera, the executive director of On Point, come and meet, and they recorded that meeting. It was very informative. I wasn't able to be at the actual meeting, but I just watched the Zoom replay, and it is very, very enlightening. For me, it was very enlightening. A lot of circling around the questions that were being asked. There were a lot of residents within the 5-block area that were voicing their concerns about syringe litter and it being near a school, et cetera, et cetera. If you'd like, I can repost the link in the chat and you can all see it for yourself if you want, if that's allowed.
That is allowed. Please do.
Okay. I'm gonna post a link to a website, and if you go down to the bottom of the website, there'll be a link to the Zoom. You'll see the letter that's been written back to Sam Rivera, and then you'll see the link to the Zoom. Okay. Thank you.
Thank you.
I appreciate all of you.
No, we appreciate you. Thank you. Tamika, please, are you able to unmute yourself?
I know Inez Dickinson's, one of her staffers came into the community board meeting with a bill that's going to restrict drug treatment centers within so many feet of schools and places of worship. So I'm gonna reach out to their team again to try to get that bill number. Maybe that's an angle that we can take as well to discuss that bill as well.
Absolutely. Thank you so much for that, Tamika. Yes, absolutely. Yes, because I did catch them say we have no obligation to be within a certain, so absolutely, we need that. That's important. Any other thoughts, comments, concerns, information that can be shared right now? This is a very, very helpful and informative meeting. I appreciate you all. Without seeing any hands, I'm going to transition us very quickly into new business, and then we can do the roll call and get out of here. For new business, I would like to, for us, and I don't know if this is even the place for me to say this, but I'm gonna say it here. Next month. So next month, I would like for us, it's the end of the year, it's December. I would like for us to come, each committee member to come with a goal. What would you like to see this committee address in 2023, as well as at least one step or maybe two steps that the committee can take in accomplishing that. I will specifically call and ask for every committee member to weigh in on this. This is important. I'm going to preface this by laying out all of the things that we have accomplished as a committee since I've started in, I think it was May. We do have a few things we were able to do. We did get our assessment completed. We did add new budget items to the list. We were able to get information from providers. We were able to add on different organizations to our presentation list. So a lot has been added on, and I wanted to highlight that and show it to you all so that you could see what has happened since you've, or because I know we also have some new members, new committee members. So it's important that we, you know, because sometimes it can be daunting, these meetings, and it seems like we don't really get stuff done, but we are actually getting things done. And I am very like adamant about ensuring that, you know, we are actually doing something, you know, we're not just holding meetings, listening to people, but we actually are, you know, connecting folks and ensuring that information is being delivered or whatever the need is for us. So I will have a thorough enough presentation of what we've been able to accomplish. I'll present that as the final presentation of the evening. I know we have some presenters for December. So I'll present that information to us, and then we can end our meeting by discussing some goals that we have for 2023. I will have a few. I already have a few. I know that we won't be able to do everything, but I imagine that some of what we want to do will overlap and we will prioritize. And as a committee, we will set forth what we want to do for 2023 and we will accomplish our goals. So just wanted to give you all a heads up about that. Please start thinking about it because it will be on the agenda for next month. I will also ask you and put you on the spot, not like that, but I am going to ask you because I do want to hear from each committee member, those who are here and those who are not here, about what goals or what they want to see this committee address. And I also want to open that invitation up to the public. You know, I probably won't be able to give you as much time to walk through that, but at the very least, you will be able to share those with us via the chat or however we'll be able to discuss some of those as well. But the goal for next month's meeting is to discuss our goals and our steps for accomplishing those goals in 2023. With that, I will say, I think I will see you guys before Thanksgiving, but I will just say happy Thanksgiving, happy Indigenous People Day. Yeah, that's it. I don't think I have anything else for you. Any other last comments before we do the roll call? Going once, going twice. Okay, I appreciate y'all very much. Thank you for bearing through. Marlene, I do believe we are ready to do the roll call.
April Autry.
Present.
Shuhab Chowdhury. Osendi Garcia. Brandon Gillespie.
Present.
Jennifer Meyer.
Present.
Arturo Perez.
Present.
Isaac Scott.
Present.
Robin Strachan.
Present.
And Anne Marie Vasquez is excused. Thank you.
Thank you all. This meeting is adjourned. You all have a blessed evening and enjoy the rest of your week.
Isaac, thank you too.
Thank you. Marlene,
Thank
good
you all.
night.
Good night.
Good night.